So welcome to our webinar and thanks for taking the time out of your hectic schedules. We really appreciate it. And we're going to dive straight into the topic. So digitalisation, connectivity and IoT for hospitals and healthcare. It's a big topic today and one we relish as our healthcare, hospitals and our NHS workers are important to us all. It's easy to knock what they do and how, but it's a huge job looking after the nation's health. And so we'd like to say we love the NHS and the hard workers that are within. But like every business, times change, needs change, and costs need to be driven down in a world where they're spiraling ever higher. So today, we'll look at the following questions. Why is digitalisation, connectivity and IoT the solution? And to unpack that, we need to consider what. So what does the technology actually bring? And then how? How actually can it be done? So we're going to start with the why. Why use IoT or connectivity solutions in hospitals and healthcare? Well, with a huge and varied estate, they will not all be modern, up-to-date facilities. In fact, they're just as likely to be old, out-of-date facilities built in a different time for a different set of needs. There will usually be multiple buildings to consider when thinking of implementing solutions across any single hospital estate. And they're often multi-sites, such as this recent visit we did where the two hospitals within one trust were almost 5 miles apart, sharing staff, equipment and resources. Then there are the other challenges like ESG and need for digitalisation and of course higher and rising costs. So moving on from the why, what do we need and what does it look like? So digitalisation and connectivity are the power to solve problems, knit together solutions easier, and meet future needs. So think of how Wi-Fi has evolved in your home from a phone connection to a wireless connection and the connectivity and solutions that it brings with it. Then think much bigger for healthcare and hospital use cases. And in our time today, we will look at a few examples of safety, compliance, building management, and even safeguarding. Just a few examples of the almost limitless use cases. So let's look at one. Let's take asset tracking. Tracking and knowing where things or people are is always useful for many reasons, and the digitalization of it really helps. And it helps with at-risk or vulnerable users. They could be tracked for safety, babies, minors, elderly. Ladders and other facilities equipment can be easily tracked and managed. Even doctors or other specialist staff could be visualized as a tracked asset. And then you have buses. They could be tracked and made into a public asset, so staff or patients know exactly when to head for the bus stop. And finally, you have specialist equipment, carts, machinery, medical equipment. It could also be tracked and easily located for when it's needed. So let's look at another solution. Legionella. In a hospital, it represents a serious risk and a task or solution that has traditionally been done very manually. So how does a digitalization of this actually look? Well, our Legionella monitors are a full solution to analyze, automate and report, but let's break that down into the elements. The device itself retrofits easily. No plumbing or electrical work is needed. Monitoring is occurring every 10 seconds at the device. The processing of the data is initially done on the edge. The compliance is being established endlessly and pushed back to the Assetbook system, even if there's an outage. The reporting and analytics is comprehensive, but most importantly, you only have the headlines to review, and then you've got all of the supporting data safely behind it if it's needed. But we go further. With automations, it means a flush or a purge can be done without human intervention of dead legs or areas where use is sporadic. Nobody needs to walk down and run a tap anymore. Smart valves can do the fix. The original monitoring device then follows that event and records the results. Hopefully it's successful, but if, however, it's not, we can send alerts, push messages, emails, and even create dashboard alerts for users. This is what Legionella monitoring would look like digitalized. Let's look at another solution. Let's look at a more digitalized way to consider energy monitoring. Of course, smart energy monitoring can be placed within buildings or estates and send real-time energy data. The results then can be analysed and used to gain better insights on where you're actually using that energy. And we know that you can monitor an estate with a meter or a building with a sub-meter, or even at a fuse board level. But if you're committed to eliminating waste and really driving down and understanding your costs, you could consider heading downstream to really find out where the waste is and eliminating it. So with more granular data from devices such as connected lighting and connected or smart sockets, we can sniff out the waste. Not only sniff it out, but profile devices like sockets to not allow heaters or high energy items to be used, to turn off outside of hours to avoid energy misuse, or to turn off lights if sufficient natural light is available. Many of these approaches can produce savings that more than pay for the deployment cost. In fact, sometimes many times over, and often paybacks have been as low as just months. So let's have a look at another, but this time we'll look at a safeguarding solution. Vaping, a growing problem in the healthcare and education sector, and need to protect young or vulnerable people from a real health threat. More and more facilities are looking for solutions to this problem, and we are a solution provider. The architecture of our system allows more comprehensive deployments and a solution that goes further than others. So with vape sensors, the sensors themselves are fitted in toilets, stairwells, or hiding places. When they're triggered by a vaping incident, the devices send push messages or emails immediately to appropriate members of staff. But we can go further. We can flash the lights in the toilet or in the spaces to let people know that they've been rumbled and to stop doing it. We can capture the offenders on vision cameras, obviously outside of the toilets, and as they leave, we can store the footage so we can understand who's doing it and have conversations with them around the dangers. So for an education, of course, it's a button-down approach to solving the problem of vaping. And for reference, the camera itself could be simply a part of the CCTV system. So we're not installing new items just for the sake of it. And the last one we're going to look through today, we talked about what increased automation might actually look like. So hygiene or cleaning routines, instead of just cleaning for the sake of it, we can use occupancy information or door contacts to understand how much use an area has had rather than just cleaning it for the sake of it. We can create a strategic approach to how often, using information from the appointment types or the procedure types that are undertaken in that area. In this instance, we could create a virtual asset which uses that information from those appointment types. So it's a bit like using a weather app to show us information about weather that we could factor into a system. We could do the same thing with appointment types or procedure types. And this would allow us to better understand when it's likely that there'll need to be a clean. We can put simple buttons around the hospital that could initiate actions or alarms, automating things, getting help, for instance. We can automate patient experiences like feedback forms via an Android or an iOS app that collect live data from the patients and info that can be reviewed by ML engines to save time and to see what the patients are finding from their experiences. We can analyze all of your assets in real time to find out if there's dependencies between them. So instead of running them in a silo, we're running them together to see how they interact with each other. For example, when building automatic doors fail open, we can turn off the high power air curtain heaters above them, so we can avoid 9 or 10 kilowatts of wasted heat just being blasted out into the car park for the whole time that the doors might be broken. And immediate automation can be sent to the relevant people, and even another one can be sent to the contractors responsible for the maintenance of the doors, so they get an immediate uptake of the problem. And we can get increased engagement from all the stakeholders and a more informed workforce. We can create different dashboards and authority levels. It's a simple way to inform and educate across the workforce. You know, just those simple ones like knowing when the shuttle bus between sites is arriving or where it is on its journey will save staff from getting wet or cold. Same goes with patients. And also we can show them things like how many spaces are free in the staff car park or EV chargers, whether they're on, in service or free to use. And we can offer patients, visitors, company vehicles, and even staff different EV tariffs to build income from, while still offering staff incentives and cheaper charging. And we can monitor the charge sessions of the ambulances or the shuttle buses to learn how much energy they're using. We can publish the charges as a public asset so that they can be seen and viewed by anyone. And this is just a handful of options to choose. And the great thing about solutions is that you are the best served to understand what your solutions might initially need to be. But then once you have in place a strategy and meaningful data, then the insights and automations will follow, making it an even better system. So moving on, let's have a look at the how. Let's look at the digitalisation and the connectivity. And to do this, let's go back to the earlier example of a multi-site hospital trust. And in this case, a pictorial with some of the use cases of the hospital. And if we think about it from a connectivity perspective, we already have Wi-Fi inherently in place. So we could pick up and use that just to see some of these devices we could use that for. We could use it for energy monitoring or people counting and CCTV, for instance. They would work well on Wi-Fi. For lighting, we could use LoRaWAN for the street lighting, Bluetooth for the standard indoor lighting, and maybe Bluetooth or Zigbee for emergency lighting, for instance. Street lighting is a wider area solution, so not really ideal for a mesh type topology, whereas lighting indoors and emergency is so pervasive that it is usually perfect for a mesh system. For vehicle tracking and EV, we could use 5G or similar cellular service for simple, robust comms infrastructures. For EV charging, simply provide the power to the far end of the car park, and then the cellular network will do all of the rest in terms of control, reporting, analyzing, etc. And also for the vehicles, you could publish the info as a public asset, as we said earlier, on your system, and then you'd know where that shuttle bus is, regardless of the traffic situation. And for asset tracking of items, carts, ladders, and parking space control, we could use LoRa for that. LoRa is a wide area network. It allows us to really penetrate over large distances. We could put 2 LoRa coverages in, one per site, and with just 2 gateways, we could cover the whole area and also create a backbone for other future devices and services. Furthermore, with this, we could create geofences, so any items that are not allowed to leave a specific site We could create notifications and messages if those items leave site. And then for others, we would always know where those items are and if they're needed. And so you can begin to see that actually there'll likely be a need for multiple protocols to use if you want to do best in class or make best class use cases. Some might mesh, some might need wider area networking, some might need more data or bandwidth, some might just simply send small packets of data twice per day. So strategy around the IoT is key, as is the flexibility. But it's pretty clear now that the best solutions incorporate the best devices and the best mythology. We at Assetbook incorporate all of them, and you have it all ready to go as a no-code platform. You can save money, you can deploy quicker, and you can build a more powerful system. And they communicate with each other. They're not in useless silos. They can trigger, automate each other, regardless of the protocol or networking. And most importantly, you can see them all and control and automate them all in one single pane of glass view. IoT devices collecting data is just that, unfortunately, sometimes a lake of almost useless information. But smart, digitalized end-to-end solutions that are unified are where the value lies. And today, we covered a few solutions from a huge array of fixes that we have in our unified system. Unification of everything brings better value, more insights, and endless solutions. And to finish off today, one quick do and one quick don't in terms of how you might go about building your digital strategy. Do build a unified but totally agnostic system, as it will give you the freedom and the power. The most useful and powerful solutions will incorporate the best technology, the best devices, and very possibly be across multiple topologies and communication methods to get the most from your install. And in this instance, a great built-in pictorial just to show a few options you could have in that unified system. And then don't build this. A system of silos, a BMS that does or doesn't do parts of integration, a set of separate solutions, a dashboard system for the beginnings of an ESG that will never go further. None of them collaborate or work together. Lots of subscriptions, lots of proprietary hurdles, and lots of different disparate systems. So Think Assetbook is how you can do all of what you saw today and much more in a single multi-protocol agnostic system. Build value today and future-proof your business for tomorrow. And now we welcome any questions.